Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. The experts will discuss a possible tripledemic that could threaten the U.S. healthcare system this winter. With flu cases higher than normal, RSV infections on the rise, and more COVID variants developing, the experts will provide guidance on how to stay safe and navigate the current public health landscape. First, I'd like to briefly introduce our speakers. Dr. Andrew Pekosz is a virologist professor and vice chair of the Department of Molecular Microbiology and Immunology at the Bloomberg School and co-director of the Johns Hopkins Center of Excellence for Influenza Research and Response. Professor Pekosz is an expert on viruses, with a focus on viruses like influenza, SARS-CoV-2, and other respiratory viruses. He has been studying influenza and SARS-CoV-2 variants to understand how they have changed to become more efficient at infecting humans and evading immune responses. Dr. Keri Althoff is an associate professor in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health. During the pandemic, Professor Althoff has been engaged in research with large-scale cohorts of people with and without COVID and seroprevalence of SARS-CoV-2 antibodies. She has also been focused on translating evidence and safety guidance for families, including a framework for decision-making, which incorporates the risks and benefits of travel and family gatherings. We will have time for questions following our speakers' remarks. The procedure will be as follows. We will take some questions that have been submitted in advance of the briefing and some from the Zoom chat. If you have a question during the briefing, please enter it in the Zoom chat addressed to all panelists. Please enter your name, media outlet, and question. We hope to cover as many as possible. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. Participants will be muted during this briefing and it will be recorded. Dr. Pekosz, please go ahead.
Thanks, Ellen. First, a couple of general points. We'll be talking about case numbers for COVID-19, influenza, and RSV, but it's important to note that those case numbers are probably underreporting the actual number of cases because people with mild illness or those taking home tests are often not counted in official numbers. It's also important to note that with RSV and influenza, both the elderly and the young are susceptible to severe disease. But obviously, people of any age can spread these infections, so all of us need to be aware of the current situation. Now, with COVID-19, case numbers have stabilized or are increasing slightly, depending on what part of the country you're in. In the US, a number of descendants of the Omicron BA.5 variant have emerged and overtaken that variant as the major ones circulating in the US. Now, bivalent boosters continue to work against severe disease despite the presence of mutated variants. So it's important to really keep that on the table in terms of a tool to address severe COVID-19. Now, some studies of the immunity induced by bivalent boosters have suggested that the boosted immunity isn't as strong to what previous boosters have provided. But this is actually not unexpected because we are now giving boosters to a population that has a lot of pre-existing immunity, and that tends to minimize the size of the immune response generated by the booster. Now, with influenza, we've seen very large numbers of influenza cases across the US, with most states having case numbers far above anything we've seen since the 2009 H1N1 pandemic. These cases have emerged much earlier than normal. Again, we have not seen this number of cases this early in the US since the 2009 H1N1 influenza pandemic. And at this time, pediatric case numbers appear to be increasing faster than adult cases. Now, with influenza, there are a lot of variants circulating, but most are closely related to the vaccine strains that are available here in the US. Still, viruses mutate and the circulating strains aren't a perfect match to the vaccine. But as with COVID-19, minor changes in the circulating strain compared to the vaccine strain shouldn't be used as an excuse not to get the vaccine. With RSV, cases have stabilized, but they've stabilized at a very high level. Only limited data on virus sequences is available, with no major changes from previous years being detected. Most scientists think this surge in RSV cases is primarily driven by reduced population immunity in younger populations, since RSV infections have been very limited over the past 3 years. And this same principle may also be contributing to the higher number of pediatric cases of influenza this year. And again, I'll end by emphasizing that RSV also has increased disease severity in individuals over the age of 65. So while we're monitoring the pediatric surge of RSV cases right now, it's important to monitor RSV disease in the elderly in the same way we're monitoring COVID-19 and influenza. Thanks very much.
Thank you, Dr. Pekosz. Now we will hear from Dr. Althoff. Dr. Althoff, please go ahead.
So thank you. How do we keep track of all these viruses that seem to be circulating, particularly these three? Well, we do have COVID-19, RSV, and influenza surveillance systems. And we also have a surveillance system for influenza-like illness, which imperfectly summarizes the impact of these three predominantly circulating viruses and other viruses that cause influenza-like illness. So the indicator that we're closely watching right now is hospitalizations. And we all know from the last 2 years that when hospitals fill with sick patients and healthcare workers are also getting ill, this is not the ideal situation for individuals seeking care for respiratory illness or for other illnesses or injury. So we must remember that when this hospitalization indicator ticks up, it's going to take about 2 to 3 weeks for us to turn that around with the help of mitigation efforts to slow transmission and infections. That's just the timing of how these indicators work together. So what can we do right now to protect ourselves, yourself, your family, your community? So first of all, get the flu shot. Don't wait any longer, particularly if you're an individual who is either on the younger or the older ends of our age spectrum, or you're at high risk for severe influenza-like illness. And also get your COVID bivalent booster. Again, don't wait any longer, particularly if you are either an older person or at higher risk for severe COVID illness. And then, of course, help protect the ones you love the most, which include our youngest and our oldest family and community members at this time, as well as those who are at greater risk for severe respiratory illness from these viruses. So here's how. First of all, consider masking, spacing, increasing hand washing, all of these mitigation strategies, particularly when you are in public spaces. So if you are traveling, you're mixing with lots of people, so consider that masking and frequent hand washing. If you're at the grocery store or in other indoor public spaces, consider masking and giving that 6 feet of space. If your child's classroom has numerous kids absent for illness, consider having your child wear a mask until the wave slows in that classroom if they are able to wear the mask appropriately for the day. Keep testing for COVID. If you are going to visit an older loved one in particular, particularly if it's at a residential facility, please do an at-home test for yourself to ensure that you are not bringing COVID to that loved one, and then follow all the rules and guidelines, including mask wearing at these different residential facilities or when just going to visit a loved one in their own home. Ventilation, make sure that you are moving your holiday celebrations outdoors or to well-ventilated areas. We are starting to see that uptick in cases for all these different viruses, as well as upticks in hospitalizations. That is from that Thanksgiving gathering. So please do make sure that you are doing what you can in terms of ventilation when you gather. Stay home if you're sick, and do what you can to help keep the virus away from other family members or household members. This is not equally feasible for everyone in our society. Reach out to your local health departments to see if they have services like pharmacy delivery, if that's available. Reach out to your neighbors for help. Let your primary care doctor know if you are ill through telephone or electronic health record messaging, particularly if you are at high risk for severe illness, as antivirals may be appropriate for you to fight influenza or COVID-19. Seek medical care if you are having trouble breathing. And as hard as it may be, normalize those last minute holiday gathering cancellations if someone is not feeling well. These common sense approaches reduce the likelihood that one of these viruses enters your household and impacts your work, your life, and your leisure plans. We have endured 2 long winters with COVID. And this year, common sense approaches that we've learned can be impactful for reducing the likelihood that any one of these viruses enters your home. Mitigation tools are key, and if we choose to use them, we can better take care of ourselves, our families, and our communities.
Thank you, Dr. Althoff. Now we will take questions. Reminder, if you have a question, please enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. We'll start with a couple of questions from Julia Landwehr at Health. For Dr. Pekosz, the CDC said in a briefing on Monday that this year's flu shot seems to be a good match to the strains that are currently circulating. Why then are we seeing incredibly high numbers of flu cases?
So there's a couple of reasons for that. One really starts with how many people have taken the flu vaccine. 40 to 50% of the population that's eligible has only taken the flu vaccine. That leaves a lot of people that don't have immunity that's freshly induced by vaccination. So as Dr. Althoff mentioned, using vaccines is the way that we can reduce disease burden. Vaccines that sit on a shelf are of no use. It's vaccines that are in people's arms that actually mediate the reduction in disease potential. Secondly, we know that all vaccines aren't perfect in terms of being 100% efficacious. So even at best, influenza vaccines reduce disease severity and case numbers, but they're not at 100%. So those two things are the things that are under our control in terms of being able to increase protection from infection. The second thing is virus infection always does cause an increase in your immunity that protects you for influenza for sometimes 1 or 2 more years. And the lack of that virus-induced immunity is probably meaning that more of us are susceptible, particularly people who aren't taking the vaccine. So it's a combination of things that are essentially turning our population into one that has a lot of people that are very susceptible to infection. And now that we're moving into the fall under conditions where virus can spread well, we're seeing that large increase in cases.
Great, thank you. And for Dr. Althoff, is it likely that the U.S. can increase its flu and COVID vaccine rates ahead of the winter season, or should people consider implementing preventative measures during their holiday gatherings over the next month?
So can the U.S. increase its flu and COVID vaccination rates ahead of this winter season? Absolutely. It depends on choice. Go out and make sure you have your vaccines as we prepare for the winter and the upcoming holidays. And should people consider implementing preventative measures during their holiday gatherings over the next month? Absolutely. Just as Dr. Pekosz said, our vaccination rates are not where they need to be regarding the COVID bivalent booster and regarding the influenza vaccine. So we are going to need additional layers of mitigation strategies, thinking about, in particular, the most vulnerable people that are coming to your holiday gatherings, and choosing your mitigation strategies appropriate to them is the way to go.
Great, thank you. Here's a question from Cecilia Smith Schoenwalder at U.S. News and World Report for both speakers. And why don't we start with you, Dr. Althoff? What do we know about how the updated COVID-19 booster shot holds up against the subvariants that are now circulating, like XBB and others? Is the decreased effectiveness a reason for concern? Dr. Althoff?
Sure. So right now, what we're seeing is that there is good effectiveness against the vaccines. It could always be, against the circulating strains. It can always be better, but there was just data released this past week looking at real world effectiveness against infection for COVID-19. And we are seeing that the bivalent booster is helping to protect people above and beyond those who do not have the bivalent booster. So please do go and get that bivalent booster.
Thank you. Dr. Pekosz, anything to add?
Yeah, just from a virus perspective, viruses always mutate. And so it's highly unlikely that we'll be in a situation that we will have a perfect match between the vaccine and the circulating strain, because It can take 2 months to 6 months to make the vaccine. And during that time, the virus is replicating and mutating. But again, that's no reason not to take the vaccine, because we've seen data that suggests that even with these mutations, the vaccines are holding up, particularly against severe disease. So virologists like myself are worried about these mutations, but right now, these mutations shouldn't affect whether or not you take the bivalent vaccines, because they're working.
Great. Here's a question from Ariel Dreher at Axios. For both speakers, and Dr. Pekosz, why don't you start? How effective or not effective are at-home COVID tests right now at detecting the circulating COVID variants? And what does that mean for people who have symptoms but don't test positive? And for those people who might be asymptomatic and not know it?
Yeah, the at-home COVID tests seem to be working just as well against these new variants as they have been previously. I know personally and from talking to individuals that the companies are constantly checking new variants to make sure that their tests are still detecting them well. Um, if you are feeling symptomatic and you test negative for COVID-19, usually the most likely reason is that you're infected with something else besides COVID-19. Um, it's important that when you're taking care of yourself, when you're thinking about what to do, if you're feeling sick, there really should be no difference whether you're testing positive for COVID-19, for flu, or for RSV. If you're feeling sick, stay home, take care of yourself. If you're in a high-risk group, seek medical attention so you can get some advice as to what to do. There's a lot of viruses now out there that are causing similar spectrums of diseases. So if you're feeling sick, you are sick. If you test negative for COVID-19, then it's probably something else that's causing those symptoms.
Great, excellent. Dr. Althoff, anything to add?
It's also important to remember that oftentimes with the COVID-19 at-home test, if you are symptomatic and you take a test and it's negative, it is wise to wait another 24 to 48 hours and take another test and ensure that one is negative as well, to be sure that you do not have COVID, particularly if you are experiencing specific symptoms to COVID, namely the loss of taste or smell. But as Dr. Pekosz said, if you are not feeling well with a respiratory virus, you need to stay home. Please don't spread it to others in the community. Do your best to contain it even within your own household, and always seek medical care if you are having trouble breathing.
Great, thank you. Here are several questions from Caitlin Tilley at the Daily Mail. Starting with you, Dr. Pekosz. Will what we're seeing with strep A in the UK be replicated here in the US? If not, why not?
So we're not sure if we're going to see a large strep A outbreak here in the US, but it is important to note that virus infections can often lead to a bacterial infection, and oftentimes severe disease is caused when you have that combination of a virus infection and a bacterial infection. Now, antibiotics don't work against virus infections, and so we need to be clear that if you're infected with a virus, you shouldn't be taking antimicrobials because they're not going to work. But if you develop a secondary bacterial infection, then it is important to take some antimicrobials, because that will help you recover quickly. So secondary bacterial infections are important in terms of causing severe disease, but we don't know if we'll see a large strep A increase here in the US.
Great, thank you. And for you, Dr. Althoff, do you have numbers of children who died from RSV and flu this year yet? Do you have the number?
So the CDC is tracking influenza deaths in children under 5. And I believe last week, Friday is typically their reporting dates, it was 14. So that number is either the same or likely to go up tomorrow, sadly. So we are seeing deaths from children from influenza. Last year, it was 5 total in the season. So we are exceeding that number now almost by threefold. And we are in the first week of December. RSV is those numbers are not in yet. The deaths, those are not tracked on the weekly basis. But in general, in most seasons, about 100 to 300 deaths from RSV occur in children under 5 each year, according to the CDC.
Wow, okay. Questions from Ivy Lyons at WTOP News. Starting with you, Dr. Pekosz. What communities or demographic groups are you seeing predominantly impacted by RSV and flu this year? Do these groups match those that we saw during the COVID-19 pandemic? Why or why not? I know you've touched on this.
Yeah, well, when it comes to severe disease, right now it's the pediatric population that's being hit very hard by both RSV and by influenza. Um, the adult population is experiencing surges in influenza cases, and we expect probably that that population will continue to then increase and maybe become the dominant population that's being infected with influenza A virus. There's not much data on RSV infection of normal healthy adults. But as I mentioned before, we are also monitoring the elderly for both influenza and RSV because disease severity in that population is much greater than in young adult populations.
Great, thank you. And for you, Dr. Althoff, should community members expect masking and social distancing, the suggested mitigation strategies, to remain a part of health conscious social life for the coming years?
One of the things that we learned a lot about during COVID was how all of these mitigation strategies work and how they work well when they are layered. So at this time, as we face these now 3 viruses, but all respiratory and with similar transmission patterns, we are at a place where we get to decide whether or not we're going to use those mitigation strategies like masking, like keeping some additional space between you and another person. And I feel like those mitigation strategies were hard earned during COVID. We had to do a lot to learn about how effective those were. So there's really no reason to not employ them. Now, are we going to see this at community levels, community mandates? I don't know. I think one thing that could be a potential trigger for that is quite simply our healthcare system. If we see such a surge in those needing hospital care, that our hospitals are once again stressed, which a lot of areas have seen that, particularly in the pediatric populations already this fall, then I think it's really important for communities to consider masking. You will note that in clinical spaces like hospitals, most hospitals masking is still required. And you will note that there are people out in your communities right now who are likely masking. And so particularly when you are in those public spaces that everyone needs to utilize, public transportation, grocery stores, places like that, be considerate of others. You may not know an individual's underlying condition who you're standing next to. So if you're not well, don't be in those spaces. And if you are in those spaces, consider wearing a mask, because it's our individual choices that are going to help protect ourselves, our loved ones, and our other community members.
Great, thank you. And another question for you, Dr. Althoff, from Ava Joy Burnett at WJZ. Beyond what we already know based on our experience with the flu and COVID, what steps can be taken to protect children and older adults against contracting RSV?
This is a great question, because these are populations that we have to be really cognizant of right now. If you have a small child, if you are a parent or guardian of a small child, and you have them in public spaces or at family gatherings, please do be sure that the only people who are touching or getting close to your baby are those who have washed their hands, and potentially even wearing a mask, to ensure that they are not inadvertently transmitting influenza or RSV to your child. As a mother myself, who one time had a child in the PICU for a respiratory virus, it's awful, and no parent wants to be there. So being considerate of those little ones, and parents thinking carefully about how to best protect them while still engaging with loved ones is really important. And it's hard. Those boundaries are hard. And as for older individuals as well, thinking about going to see your older loved ones right now, thinking about testing for COVID, thinking about masking, thinking about all of those things you can put in place so that you can still have that social interaction, you can still have that boost to your emotional and mental and social well-being without inadvertently transmitting that virus to others is really key this holiday season.
Great, thank you. And here's a question from Dan Vergano at Grid News for Dr. Pekosz. How do you view the theory that viruses may interfere with each other? There was some hope that this was protective, for example, the flu against a COVID surge this season. Can you
Yeah, it's a
comment?
really interesting question. At the population level, we oftentimes see that one respiratory virus dominates during a particular time, and then cases with that virus die down before another one comes up. And that may be what we're seeing right now with influenza and COVID in the adult populations. Again, a lot of flu in the adult populations, not as much of a surge in COVID in those populations. That viral interference theory doesn't seem to be holding true for pediatric populations. And it may simply be that there are so many susceptibles in those age groups that the viruses can just find individuals to infect there. And this co-infection isn't really playing a role in terms of limiting one virus or another. So viral interference is a phenomenon that has been shown to occur, but right now in pediatric populations, that doesn't seem to be having a major effect because both RSV and flu are really running rampant in those populations.
Great, thank you. And here's a question from Meg Winggerter from the Denver Post for you, Dr. Pekosz. Do we know if we've essentially compressed 3 years of flu and RSV into 1 year, or if there is greater severity from 2 years without those viruses?
Yeah, so right now, the indicators are very clear about large numbers of cases. And that means that we're having larger numbers of people that are susceptible to infection. And that may be a result of a few years of lack of spread of these viruses and reduced immunity. We're still working through the numbers to see if on a per case basis, we're seeing more severe influenza this year. And some of the numbers that Dr. Althoff has mentioned, they are high and they're occurring early. But if you think about them in proportion to the total number of cases, we're not seeing a very strong increase in the percent of cases that are driving severe disease right now. Again, that may change, but really right now it looks like what we're seeing is a larger number of susceptible people. You're seeing more cases, you're seeing proportionately more severe cases, but you're not seeing a really large surge in severe cases compared to total cases.
Great, thank you. Here's a question from Megan Meserly at Politico for Dr. Althoff. Can you speak more to how concerned you all are about the rise in COVID hospitalizations we're seeing right now?
So I think healthcare workers, and I am married to one, will tell you that what happened last December and January when Omicron emerged in so many of our communities was pretty awful. And there are so many pediatric hospital staff right now who are in a surge and a crunch, unlike anything they saw in the pediatric populations during COVID. And, the idea here is remembering that although these systems have been tested, and sometimes that does build a little more resiliency in the system, we also have to realize that these healthcare workers are people. And they are also pretty exhausted at this point from what has been going on. And they are still going to work every day and caring for people. But the idea of having our healthcare system stretched so thin again this December and January is just incredibly concerning and discouraging for so many people in the healthcare field. So really doing our part as individuals in our communities to ensure that we have put together our individual strategies of vaccination, of masking, of reducing contact with individuals who may be sick, by reducing your potential to transmit by staying home if you're ill. Those types of things are just really important right now so that through this holiday season, people can still safely gather without another really dark December or January where our hospitals are just overwhelmed.
Great, thank you. Here's a last question for you, Dr. Pekosz. Why does RSV only seem to severely affect infants and young children? And is there a vaccine in development?
So we primarily see the severe disease in young children because we think that's their first exposure to the virus. And therefore, their bodies need a little bit more time to come up with the immunity that will control the infection and protect them from further infections. Adults can get infected with RSV, but for the most part, those infections are rather mild and don't have any long-term consequences. And that's the other thing that's important to know about RSV infection in pediatric populations. There can be some long-term consequences in terms of, for instance, higher rates of asthma in RSV infected pediatric populations. So as you get older, you have that pre-existing immunity that dampens the severity of the disease, keeps you from getting the severe disease. As you get older, that immunity really wanes and is harder to induce. And so you therefore have an uptick again of severe cases in the elderly with RSV. So you can have cases across the age spectrum. Your pre-existing immunity keeps the disease severity lower in normal young adult populations, but that isn't there to protect the pediatric populations from severe disease.
Great, thank you. And thank you both to Dr. Pekosz and Dr. Althoff for your presentations and insightful answers. We will email the links to the resources mentioned today and shared in the chat. And with that, I'd like to say thank you again to everyone for joining us today.